computer. All right, looks like I'm recording. So the purpose of this meeting today is just so I can go over some of the expectations and informations about the comprehensive exam. It used to be called a comprehensive exam. Now it's called comprehensive directive study. And so this is your Canvas site here. I thought I'd take a minute to go over that. Karen, is this your first online class?
Online for APU.
Okay, so it might be a little different. I know Mayu's taken a bunch of classes online before, but this is what it looks like. And what I'd really recommend that you do is go and look at the syllabus. And I've already clicked on that and downloaded it. So if we pull up the syllabus, hold on a second. It goes over all the information about the course, the textbooks, and has my contact information on there. So there's my email, there's my cell phone number. I'm actually right now in Florida, and so I don't have an office number. So you feel free to call or text me. I said between 5 a.m. and 5 p.m. So for you guys, for me, that's, let's see, 5 a.m. It would be 8 a.m. to 8 p.m. So you can go ahead and text and call between those times. Other than that, just send an email. So this course is really to take a look at everything you've learned in your master's course and put it all into one big 20 to 30 page paper. Sounds kind of daunting, huh? Mm-hmm. So the course description, it just says the course guides the student through the process of demonstrating an integration of theoretical and clinical and research knowledge. Critical thinking is enhanced through careful consideration of information presented during discussion. The examinations are taken as part of a seminar. So this is really kind of a seminar. It used to be just a face-to-face class, and then we transitioned it to online. So we've kind of taken the online approach to seminars with this class. So the syllabus will go over the outcomes, and it really, this is a important part here is about the student expectations. So at the end of the class, what we're going to have you do is write one type of paper and then prepare an oral presentation. So the paper is worth 60% of your grade, the presentation is 20% of your grade, and the discussions and are another 20%, equaling 100%. So the choices that you have for your paper is to write a comprehensive study, QI, quality improvement, evidence-based practice, intervention proposal paper, or write a paper that you want to publish at a journal. So usually what students do is choose the first one, but you are, if you think that you would want to publish in a journal, that would be awesome. You can just talk to me about that. What I will talk about mainly today is the first option. So other options that you can write a research proposal, grant proposal, or a master thesis. These really require that you already planned ahead to do this because you're supposed to take a grant writing course beforehand. So I think what we'll mainly look at are will be options for y'all are these two, and most of you will probably do this QI EBP intervention proposal paper. So I will go over that today. The textbooks are just the APA book, and then there is a little bit about this. We just, the APA publication manual just came out with the 7th edition in October. So if you guys have already bought the 6th edition, you don't have to buy the 7th edition. There's not tons of changes, but if you have any questions about any differences, you can go to this resource here, the APA style blog, and look up anything specific there that you need to know. I think the biggest change that we might encounter is you don't have to put a running head anymore, so that's really nice. And then there's a free textbook. So one of the things I'm involved with at APU at our school is to try to decrease textbooks costs. So I go out and I actively look for free textbooks. So this is one that we found. It's literature reviews for education, nursing graduate students. So that's a great resource because a big part of this paper is going to be a literature review. And then these are just other recommended books. If you want to look at those, you can. The course schedule, so if you click on that, it'll take you to the calendar. It's a Google Doc, and you might find that during the course of this semester, will share a Google Doc with you, but it isn't open for you to look at. So just if that ever happens, just click the button below. It'll send me an email and tell me to share the Google Doc with y'all. So the syllabus will go through the discussions. Make sure you are aware of what you need to do to get full points. In the Canvas course, there's also a rubric, and that'll go over requirements to get full points. There's the comprehensive paper, and this kind of walks you through the paper. And so good idea to read that, especially as we're going to go through each of the sections of the paper week by week with drafts due. And so maybe come back to each of these sections during the week that we're looking at them. So I think just to read a 14-page syllabus, you're not going to sink it all in, but when you need to apply something is when you might read it and say, okay, this is what I need to do this week. So it goes through the paper. The first part is the background and significance, then a literature review. We'll do a theoretical conceptual framework. So your intervention should be have a framework that it's based on. You'll pick some kind of intervention that you would like to propose at a clinical setting. Then you will have a conclusion and recommendations and have your references. And the poster for this course, what we're going to have you do is do a poster of your the paper that you wrote. And you can do a poster presentation virtually by doing it like this as a Zoom meeting, or you can do something where you have a poster and then you embed slides on the poster and do kind of a asynchronous presentation that you will share with me and your second reader. So here it just goes over the point allotment that we talked about, and just so you know that you need to get a B- in this course to pass. I think that's all there really is in here. I think this is kind of important here where it says students who have failed to make satisfactory progress on their paper by week 7 will be issued a warning. And I think that you would want to have a warning, right? If you got to week 7 about halfway through the class and you weren't, it wasn't looking like your paper was going to be something that would be passable. Okay, so I think that's it. Let's go to the calendar. So here's our little calendar that goes through week by week. The first week, we've just done our intro discussions, and you've started to share with me a little bit about your topic that you might choose. And I think that's great if we can maybe, narrow down your topic a little bit this week, and then next week we'll get it, we really should have it cemented by the second week so that you will have time to complete your paper. So be thinking this week about what you want to do for your topic. So each week in here, most weeks there's discussion posts, but not every week. So you can go in the calendar and look, and it'll show you on Canvas in the modules. So there'll be, starting week 3, you'll start sending me section drafts. So each section draft, or each week there'll be a section draft. And this really, I think, helps you to stay on track of for your paper. So I think if you wait to submit your paper at the end all at once, I mean, you can do that. These section drafts are not graded, but people who do this usually don't pass the course. So I would recommend that you provide me with a section draft, and then we also recommending that you go to see the Writing Center for them to help you with each of these sections. So the section drafts, you can give me one section at a time. What I prefer to see is kind of a running iteration of your paper. So first you send me the background. Sorry guys, I lost you. Let me share it. So I'm not sure how much you caught, but I was just saying that you should send me your drafts as a running document. So you will send me your first draft, background and significance. Please send it in a Word document. And then I will make comments on the side and do track changes on there. And so you can look at it, you can fix everything you need to. You can also put comments on the side of your paper if you have any questions for me. And then the next week, add the next part of your paper and then send me that whole thing. So the next part would be the literature review, and here you can see that it's recommended that this is the time that you actually meet with the Writing Center. There is some good news that we have a spring break here. So that is March 2nd to the 6th. So that'll be great. Have a week off to kind of just digest and see what everything's going on, and maybe go to Fort Lauderdale or wherever people go to on spring break these days. So in the Canvas site, you will go to modules, and then each module is set up so that it has the introduction about the topic that week, the readings, any videos, your discussion will be here, if there's any assignments, and then reminders. So if you look at the readings for week 1, you'll see some information about selecting a topic. And so this brings you into a Google Drive folder where it talks about different kind of evidence-based interventions that are being considered now in practice. So there's the top 20 research studies in 2012. There's the proceedings from the Western Institute of Nursing Conference. So you can see some of the abstracts of what other nurses have been presenting. And then Choosing Wisely is kind of a list made by the American Academy of Nursing about 25 things nurses and patients should question. So, for example, don't automatically initiate continuous electronic fetal heart rate monitoring during labor for women without risk factors. So it goes through some things that, have always been the status quo that we should question these days. And these are all just kind of to stimulate you to get some ideas of topics for your paper, things that might be evidence-based. And if you already have an idea, then you really don't need to look at that. You can just run that by me and we can start working on that idea that you have. There's just an example here about the use of smartphones in healthcare research. There's some sample papers, and then this is the rubric that I want to go over today. And if you choose to do a publishable paper, that's the rubric for that. Okay, so I think I already pulled that up. Let's see, paper rubric. Yeah. And that will download as a Word document. So I really recommend when you write your paper that you go through this and you actually use this rubric on your own paper. Go through and check off that you have everything in there. So for this paper, you'll have 2 faculty who will score it. So I will be the first reader, and then there'll be someone else who will be the second reader. What happens is probably around week 10 or 11, I will give all of your running your titles that you have for your papers, write those all down and give them to Dr. Cohn, who's the lead faculty for this course. And then she will send all the names, the titles of your papers out to the faculty, and the faculty will look at those titles and say, you know, this sounds interesting, I have some experience with this. I'm going to choose to be the second reader on this paper. Alternatively, if you have a professor that you would like to read your paper, you could ask them already and say, will you be my second reader on my paper? Sometimes they can't because they are teaching a lot of courses this semester, or they already have agreed to read someone else's paper. But you can always go ahead and ask, but if not, somebody will be chosen, so you don't have to go out and find your own second reader. So what we'll do is we'll go through, look at your paper, and usually I have 2 monitors, so I'll have your paper on one monitor and then this abstract on the other, and I'll just read through your paper and then check off what you have there. So if you set your paper kind of up the same way that this rubric is, it'll be a lot easier for the person to score your paper and say, okay, you've got full points here, I see this here, this is clear to me. So I would recommend using these different sections here as your actual headings for your paper. So the first part will be an abstract, and I will give you some guidelines for abstract that I'll pull from the Pollitt and Beck textbook, and then you'll have some keywords there. And this should probably just be, maybe 300 words. But we'll get into that more. Then there's the background and significance, where you should introduce the reader to the phenomenon of interest, your problem, your thesis, the purpose statement, and any kind of operational definitions that are important for the reader to understand when looking at your paper. You'll talk about the background of your issue or problem, and that might include the prevalence, the incidence, and the burden. You might talk about the current state, how what strategies are available to manage this purpose, this problem or issue, if there's any standards from professional organizations or guidelines. So really, how are you dealing with this issue currently? Then there's the significance. So significance is kind of why is this an important problem right now? If you address this problem in this paper, how will it improve nursing and healthcare outcomes? And then the impetus is why you chose this. You can say a professional reason, you don't have to give a personal one, but that should be included there. The second part is your review of the literature. You'll do a 1-paragraph introduction when you'll say, the purpose of my review of the literature is, and then you can tell the reader what your PICO question is, so your population, your intervention, comparison, and outcome. And again, I know I'm talking quickly through all this, but each week will be designated to each section of this paper, and we'll go into that in more depth. Then there'll be the method section to your review of the literature, and there you'll say how you came up with the articles that you found, and you'll make a Prisma flow diagram and showing, just mapping out how you found these articles. You'll have a section about the results of what you found in the articles, and then a discussion about the results. Maybe what were the gaps that you found, and what might be some of the implications for research and practice. The related issues section is next, and so in this section you'll consider issues that you haven't already addressed in the review of the literature. So there's just a list of some things that you might consider. If they've already been addressed in the review of the literature, you don't have to address them again. One thing that is important in this rubric is that you are looking at this issue from the lens of the master prepared role that you're going to be in once you graduate. So, you know, Maya's in healthcare administration, so she would look at an issue and say, okay, as an administrator, how am I going to address this issue? And Karen, you're in the nurse practitioner program. Okay, so you would say, as a nurse practitioner, how am I going to address this? If somebody's from nursing education, they might say, what kind of curricular changes or what can we do in nursing education to better, improve this issue? Then the methods is the methods for of your intervention. So it'll be, in this section, you'll say, okay, well, based on everything I just presented, and your whole paper is kind of presenting an argument, based on this, I'm going to propose this intervention. So it could be an quality improvement project, an evidence-based practice project, or some other type of intervention. I'm not sure what that other type would be, but I just put other intervention just because there could be something else that doesn't fall in those buckets there. So you'll talk about the context that this problem is in with regard to your MSN role. You'll talk about the scope and practice standards of your role. So the scope and practice standards of family nurse practitioner, scope and practice standards of nurse educator. And the way that you are going to address this issue should be something that aligns with your professional role. And so that's what I was just saying before, that you should really look at it through the lens of what you're going to be after you graduate. So you'll say, okay, let's say we'll consider I'm a diabetes educator. So as Mayu knows, all my examples are always with diabetes. So what if we say something like, people with diabetes aren't taking their medications as prescribed. And so maybe one of the interventions that we could use to overcome this is there's e-health, where you can go in and you can monitor when people open up their pill bottles. And so that there's an electric sensor in the pill bottle, and when you open it, it can send a message to a case manager. And so that's been something that's new, and something that evidence is showing, research is showing, that works pretty well to increase compliance with medications. So that might be an example of an intervention that you say, okay, at my healthcare facility, we don't currently use this, but it is evidence-based. So I would like to propose that we use this at my healthcare setting. So you would, in your review of the literature, you might have discussed if this mHealth actually works. And at the end, hopefully you would say, yes, that it does. So you would have brought that in at the review of the literature. And so this section here, which says be supportive evidence for the intervention. So you would have, let's see, right here, results of the review of the literature would support the intervention you're proposing. You would have a theory or conceptual model that would support that. So trying to think of a theory that might work with, well, let's say the chronic care model might be a good conceptual model that says you have better outcomes, patient outcomes, when you have prepared prepared provider and an engaged patient. And when those two things happen, you get better patient outcomes. So when we're saying that this, we have this M-Health intervention, this model is really backing it up, because this M-Health, where we have a prepared provider who is using all the latest technology to treat their patients, that's shown that can improve outcomes. Does that make sense? And we'll again go over this. We'll have a whole week. We'll go over the theory and conceptual models. So then we'll have previous application of the framework. So you might show how this theory or model has been used in the past to overcome this problem. And application of the framework to your proposed intervention. You might say, okay, just what I was talking about, how there's variables. There's variables within each model, and a theory or a conceptual model says, okay, we have this variable, there's a relationship between this variable and this variable, and it shows like if you increase this, this decreases. So you just want to show that the theory supports what you're trying to do. And then you will operationalize the intervention. So you'll just kind of map out what it would look like. You know, the who, where, what, why, and when. Sometimes people use algorithms to say, you know, like, okay, the patient would come into the office, and then the next step would be X, and then, you know, go through an algorithm to just have a visual of what's going on, but you will really need to get into some detail about what this proposed intervention would look like. And then you'll say, how will I know what I'm doing is making a difference? So how will I measure this? And in my example, you might say that patients' compliance rates go up. You'll have implications for practice, any implications for research, and then you'll get some points for format and convention. So that is the APA style standard, and that it's been submitted per instructions. So do you guys have any questions on this rubric?
Not yet.
Not yet. I'm sure that you will. Okay, so that is in week 1. So each week, go through the modules and look at the readings and the multimedia. Another good place to go is into the assignments. And you can look in here and you can see all the assignments. So right here it shows that when each section draft is due. So you'll see week 3 will be background and significance. And then week 4, we'll have the literature review, one part of it, the first part, and then the next part of the literature review. And then the week 5 will be the final. No, week 5 is the analysis and synthesis of the literature, and week 6 is the final. So you really see there we have quite a bit of time that is designated for the review of the literature. I think that's really the hardest part of the whole paper. You will have the related issues draft, the healthcare framework for the proposed solution. So that's the conceptual model or theory. Then you'll have part of the next draft will include the master's prepared nursing role. Then you'll really go through the details of your intervention, the outcomes. So each week you should be adding on to the paper, and then your final paper will be due April 6th. I will have a draft of your paper that you can submit, and this will go through VeriCite, which can check for plagiarism. So that report will go to you. You'll be able to fix anything in it. A lot of times there's unintended, cuts and pastes and thing, and you just have put it in your draft and you don't catch it. So this is a great time where you can go in there, and if you do see any kind of plagiarism or duplication come up, that's a good time that you can paraphrase and rewrite that. And then there is the presentation, which is due April 13th. And then this is just for grading. There'll be a place where your first reader, me, can put in the grade and the second reader there. And then the discussions are all here. What else? I don't know if I have anything else that I really wanted to show you on this. Do you guys have anything specifically?
Dr. Olson, I had one question.
Sure.
Regarding the poster. You mentioned there's two ways. Either we, I guess, present the poster to you and the second reader live, kind of like this on a Zoom meeting.
Mm-hmm.
And the second option was, you said something about embedding slides?
Right. So I kind of think of this as when you do make a poster, and we'll go through all this, but when you have create a poster, it really is a PowerPoint presentation. So when you make a poster, you can create the content of each section of your poster in a slide. So you can show a picture of your poster at the beginning, and then your second slide that you move to might just be the slide that says background and significance. So you've kind of pulled it off your poster and made a separate slide for that. And you can embed some discussion about that section in that slide. So it is kind of like doing a presentation. The only thing is at the end, you will actually have a poster that if you wish to present at some kind of conference, that will be something that's yours and you can use as you want.
Okay, I see. Thank you.
And I guess another option would be for you to actually go to the Azusa campus and present your poster the same day that the face-to-face students do. I'll have to check with Dr. Cohn if they have that, but if that is something that you think you might want to do, let me know. I think the easiest thing is really to do a Zoom meeting like this. And then you don't have to create all those videos and embed them.
Right. Okay. Okay, thank you.
You bet. You have anything, Karen?
For the discussion, I know like for our posting, you want us to do like one reference or two reference for our posting.
Yeah.
Or like, and then also when we reply to another student, we have to put in two different references as well, right? Or
that's a great question. So let me just see if I can pull up the rubric here for you. So you should be able to see this rubric in each of your discussion postings, and you're right, it says that the initial post should address the prompt, cite 2 or more current scholarly resources and references, should be well-written APA, and then the second one says, your response should dig deeper into what the person says, that you have additional references beyond the initial post, and the response is made on a different day than the initial post. I'm not too strict about that because, I know you guys are all busy, but at least if you can go in twice a week and be looking in there. And if somebody does respond to your post and has a question for you, that is not graded, but that is nice. I think a great place where you can kind of carry on some conversation there. Get some feedback from your classmates.
and it's okay to like type our response. We don't need to make it like a video or an audio. It's only like by choice, right?
You can. Sorry, I wasn't sharing my screen before, but this is what I had pulled up. I think there is an option. You only have to type it, but I think there is an option where you can maybe do some videos or something like that, but nobody ever does that. I think it's mostly just that you're just typing in maybe three paragraphs at the most.
Okay.
Okay, I am going to stop the recording here, and then we can stay on and talk a little bit if you like. So let me just stop that.